Hello everybody, I'm Dr. Shreyas S, consultant Ayurvedic obstetrician and gynecologist. As per the recent article in the Indian Journal of Medical Research, in India, despite of population explosion, the overall doctor population ratio is 1:1800, which reflects a 3.5-fold improvement, a fact we can be proud of. However, a lot more is yet to be done to make the healthcare accessible to many. As you all are aware, even today, India faces severe shortage of specialists, both for its rural and urban services. There is a need to be innovative and urgently evolve strategies to deal with the acute shortages of specialists. And this is truer for healthcare of women in India, which is surely craving for more attention. BJOG, an international journal of obstetrics and gynecology, cites the burden of diseases during pregnancy and after pregnancy, which indicates the burden of maternal morbidity is potentially high, and yet often it remains unrecognized and undiagnosed. You will agree, most of the women's common healthcare problems can be addressed at primary level, and appropriate referral is crucial for improvising women's health. India has a legacy of 5,000-year-old system of medicine, Ayurveda. I'm sure you will agree, rich learning can be adopted from both the systems of medicine and deliver the much needed healthcare to masses. Do you think integration could help us deliver better healthcare for women in India? We must explore this with the pioneers. In this week, a webinar for obstetrics and gynecology enthusiasts, Eve Care, is brought to you by the Himalaya Drug Company with the tagline of Integrating Medical Sciences in OBG Care, a Future Prospect. 5 short talks on 5 different issues will be addressed by eminent clinicians and will be going on live air from next week. As a foreword of this webinar, we have Dr. P.V. Tiwari, ex-HOD and ex-Dean of Ayurveda IMS BHU, and Dr. Lata Venkatram, Senior Obstetrician and Gynecologist, South Bengaluru, also the Dean of Life Sciences, S. Vyasa University. Let's now hear from Dr. P.V. Tiwari.
Hello viewers, I am Dr. P.V. Tiwari and I was a practitioner in the field of obstetrics and gynecology for the last more than 50 years. Since my practice, as far as my experience, I have seen lot of scope of Ayurveda in the management of women problems. In obstetrics when we go, the first comes the prevention of the normal and health, delivery of the normal and healthy child. For that, what's the method of described in Ayurveda classes from the very beginning, how to start marital life, how to go in for progeny, those things must be taken care, and those give healthy maximum emphasis in Ayurveda given on psychological and physical health of the brain and couple. As far as Ayurveda scope is concerned, it starts from the day the woman has conceived. From the first day itself, if at all, some Ayurvedic treatment is given. It is likely to prevent sizable number of disorders, particularly initially morning sickness or vomiting, then piles, consequently digestive disturbances. From second trimester onwards, the maximum problem comes for the PIH, pregnancy-induced hypertension. The women who are prone for the disease, if they are given treatment from the initial, from third month before, we cannot give women any powders or any such thing, though not palatable, they may initiate more vomiting as the problem of the women. But from second trimester onwards, if you are giving certain drugs which prevent the causes or the accumulation of the body fluid in the body and also maintain the normal function of the kidney and other body system, those prevent the PIH in a number of cases, and even those which I have seen in practice who had even the pre-eclampsia stage in previous pregnancies, when they are treated from the early stages, they were not even, they even didn't have the PIH, what to say, much. Then in postnatal period, there are a sizable number of women who have problem of the lactation to the child. Lactation, because mother's breast milk is much more nutritious and homogeneous to the child than any other milk. So for that, there are a good number of drugs which enhance the mother's milk and also capacity of ejection. Then even postpartum, postnatal certain complications which are normal physiological, involution of the uterus, other things, those can well be achieved by use of diet and other simple drugs prescribed in Ayurvedic classes, provided those are used properly. In gynec, whatsoever is observed that the girl at the age of adolescence, when she is 12 to 14, the menarche starts, and girl has many more menstrual disturbances are the problems. So is the case when she approaches menopause. In premenopause, perimenopause, there are certain changes. Hypomenorrhea, oligomenorrhea, menorrhagia. These are the functional disorders I feel very well can be treated with Ayurvedic medicines. Another disease which is manifesting nowadays is PCOD. This is a very, I would say, refractory disease which does not listen to the treatment. Causes are very ambiguous, yet whatever causes are found. The treatment, it was because the disease is identified only in 1985. Before this, it was not existed. It was only Till-Lemon syndrome, which was slightly different from this. So this PCOD is being treated and can be treated very well with Ayurvedic medicines without any complication, and even it is seen that during the treatment, while one goes to modern, this is only hormone. Here within the treatment, patients have conceived and delivered normal. So this one which is challenging disease which Ayurvedic can treat very well, and there are certain drugs in Ayurveda which are being used by most of the persons, and they are very useful. To discuss on all these points, I will be coming live through Himalaya Drug Company platform to solve your queries regarding the same. See you all soon. Thank you.
Now let's hear from Dr. Lata Venkatram.
Namaste. I'm Dr. Lata Venkatram. I've been practicing as an obstetrician and gynecologist for more than 25 years in Bangalore. Obstetrics and gynecology has evolved over years, but still there are quite a few lacking. Even before a lady misses her periods, the early cell divisions would have happened, and the fertilized egg would have got implanted into the womb and would have started developing. As early as 21 days after fertilization, one would be able to identify the fetal heart. So it is so very important to give a proper atmosphere for this early development, and even before the lady realizes that she is pregnant, these developments would have taken place. Hence, it's so very important that the couple, when they are planning to conceive, have a good lifestyle. Then, throughout pregnancy, the first trimester is a phase where rapid development of the organ systems will be taking place. The second trimester, where these structural developments sort of continue along with maturation, and also the third trimester, where the maturation continues and the baby grows in size and gets prepared to come out and live as an individual. These are two phases which are again quite important, where there is a lot of development of the organs. Not only the development but maturation. Hence, it's important that the lady gives the best to have the best. Pregnancy provides a window of opportunity for the reflection of maternal health. For example, if a lady develops hypertension during pregnancy, there is 50% chance that this lady can become hypertensive in the next 5-10 years. Or even with diabetes, the same thing holds good. 50% of them can become diabetic in the next 5-10 years. So it gives us as an opportunity, pregnancy gives us an opportunity to correct their lifestyle and prevent these diseases. Next thing is even the postpartum care, how to look after the baby, how to look after the mother. All these are very important aspects, not only for maternal well-being but also for the well-being of progeny. Coming to gynecology, after all, menstruation is a program, okay? It's a cycle. So I think it's very important that we realize that an individual has to be looked at as a whole. Just blocking the symptoms, for example, if somebody had menorrhagia, just reducing the bleeding is not going to be the solution. I think we have to go to the root of it, and it is very well described in Ayurveda how to go to the root of the problem. The other things like fibroids, endometriosis, etc., where a lot of things have to be said about the lifestyle changes have to be incorporated along with the modern medical treatment. Menopause, premenstrual syndrome, it's an exaggerated response of the body and the mind to the normal physiological changes that happen in a woman's life. But unfortunately, the many women will not be able to bear that, and it manifests as dis-ease. So I think it's important that we give them the concepts of how the disease is caused and how they can cure themselves rather than sticking to medications for a long time. PCOS, it's a lifestyle disease, I would say, which involves multiple endocrinal systems. Vaginal discharge. Vaginal discharge again has been a very common problem in women, but it's physiological to have vaginal discharge. 2 weeks after a period, they are known to have, women are known to have discharge, and also prior to periods, there can be slightly excessive discharge. As long as there is no itching, irritation, very offensive smell, and also not mixed with blood and not very copious where they need to use protection, we should reassure saying that it's something physiological. So I think as modern medical practitioners, we should be prepared for integrated approach, and we are very fortunate that our country has very well trained Ayurvedic specialists whose services we can utilize, and we have to form an integrated platform for treating women. It should no longer be just one system of medicine, but if we are really concerned about the well-being of a woman, I think we should look at her as a whole and integrate these medical systems into our treatment. Thank you very much for giving this opportunity for me to share my thoughts with you. Namaste.
We are sure you have plenty of questions for our speakers, hence we bring you an opportunity to post your queries and experiences. You can post them on the YouTube channel of Salubrity Doctor. Our speakers will answer them during their live sessions. We begin with the curtain raiser live next week with Dr. P.V. Tiwari and Dr. Lata Venkatram. Live will be on the Facebook page of Himalaya as well as the YouTube channel of Salubrity Doctor. Like, subscribe and share the YouTube channel of Salubrity Doctor for further updates on Eve Care webinar brought to you by the Himalaya Drug Company. Michelle Obama rightly put it as communities and countries and ultimately the world are only as strong as the health of their women. So let's Eve Care.